So, hi everyone. I am super excited and happy to have with me a very dear student, Dr. Maulik Jayantkumar. He is a proud Damsonian and he secured an amazing score of 221 in the recent FMG exam. So, heartiest congratulations, Maulik. This is a wonderful performance, bache.
Thank you very much, ma'am. Thank you. Thanks a
A-
lot.
And how do you
Uh,
feel, Maulik? Because
I
you
am
know this.
actually a lot excited, ma'am.
Yeah. Yes, because
Yes.
when we talk about the FMG exam, we all know that the pass percentages are not very good, and your friends, colleagues, everybody tries to scare you about it, and it feels like a task which is very, very uphill. And now that you're on the other side, or I should say at the top of the hill, do you like the view?
It is really good, ma'am. A bit relaxed now. After
Great.
the results, we are a bit relaxed.
Yes, I can.
And I must tell, oh, it's all because of DAMS faculty. I used
No.
to get a little scared in between. So I used to watch your videos, Sumer sir videos, motivational videos, and it was a hope which helped me a lot.
That's wonderful. It is a pleasure that we could be a part of your journey. So thank you so much.
Uh,
Maulik, I'm sure your journey wasn't all, roses, right? So can you tell us
it was
something? Yeah. So can you tell us something about where you pursued your graduation from? How was your journey? How did you study? What was your strategy?
Ma'am, I started my education in China, in
Okay.
Guangxi Medical University. I
Okay.
pursued my MBBS. I
Hmm.
went there. For first year, I just used the standard notes, BD
Okay.
Chorisia and all.
Hmm.
And after that, I kept on studying, but it was like I cannot understand. I can understand the subjects. I cannot memorize anything. I
Right.
cannot grasp anything. But after that, I came here after the COVID
Hmm.
and I joined DAMS class in 2021.
Okay.
I joined the integrated class, and
Right.
the first lecture for me was surgery. Tiwari
Okay.
sir came, and it was really, really good. Tiwari sir made my day. So I pursued DAMS after that. And
Okay.
after joining DAMS, I started making notes, and I used to make notes in the weekends. And after that, I used to go back and study in the weekdays. And as Sumer sir advised, I used to solve around 50 to 100 MCQs. Around 50, I couldn't solve 100,
Yeah.
but around 50, 70 MCQs I used to do in a day, and used to give GTs after that.
Okay. So
So
I think, Maulik, yes, I'm going to, before you go further, I would want to interrupt you here. Sorry for that. But I think there are two very, very vital things that you pointed out. So, one thing that I really loved what you said was that you were attending classes over the weekend, but after that, you were going and revising those notes. So, I think that is a fantabulous thing to do. That is how it should be, because it ensures your consistency is there. It ensures that you're revising, because the more number of revisions you do, the better you get. Yes, because
obviously, ma'am.
yes, and it's very essential that you understand that you have the concise crisp notes with you. You have to do justice to them. Nobody can know them in the first go, but every reading makes you better. Yes.
It's like we get to experience new things. We get to see new doubts after every revision.
Yes, that's true. That's true. And the second thing, which I think was very vital, that you said that you started practicing 50 MCQs every day. And I think that really adds value, because it tells you where you are weak. It tells you whether you're able to apply the class notes or not. It also gives you confidence, bit by bit, that I'm moving forward,
Yes,
right?
ma'am. It does. It does. And uh, after solving MCQs, my confidence level became a lot higher than it was before. And
Great.
in the last few months, I used to give a lot of GTs.
Okay.
So I started doing two GTs in a month, and
Hmm.
slowly, my score started improving.
That's
And
great.
in the end, I started giving previous year question. I used to do previous year questions and previous year tests. I started doing, and
Right.
I used to score good. I used to get good marks in them.
That's
So I
great.
used. I was really happy, but after the exam, I was a bit scared.
Yeah, because paper two was tough, right?
Paper two was quite different from what came in the previous year questions.
Yes, yes.
Previous year didn't have such questions. It was
Right.
mostly neoplasia and all. So,
Yes.
but
And I
your
think
strat. Mhm.
sorry. I keep
No, no,
interrupting
no,
you. I'm so sorry.
no, no. It's
And
fine.
I
It's
think
totally fine.
and I think even in paper one, you had integrated questions from basic sciences merged with clinical subjects. Am I right?
Yes, ma'am. There were a lot of them.
Yeah. So
Mostly
go ahead, go
pedia
ahead.
came.
Hmm.
So it was really helpful to join DAMS. If I haven't joined the DAMS, it wouldn't be as good as I had for now.
Right. And do you think, Maulik, that doing the classes live had an impact rather than just going through the videos?
It was a game changer, man. It was a game changer for me
Mhm.
because I used to start doing pre-recorded videos in China because
Yeah.
I was in China for first 2 years. I started doing
Right.
pre-recorded videos for everything, and I
Hmm.
used to complete one subject in like 2 months.
Oh,
And
yeah.
here it takes a lot of time because there we have a lot of distractions and everything.
Yes. Yes.
After coming here, I start joined the class, and it was like we can complete a subject in 3 days, 4 days.
Yeah.
It was so good that we had a motivation that if we can do it again in next 3 days, then our
Yes.
whole subject is done again in 6 days, two times.
Absolutely. Absolutely. I think your experience from China sort of helped you because you had already tried something and you realized that it is like even if you're able to do it once, it's very difficult to do it again if the videos are there because you just keep procrastinating.
Yes, ma'am.
Okay, and
It
and you
takes a lot of time to do the recorded videos,
yes,
and the DVT helped me a lot in the end because it's like we can complete a single subject in 2 hours. It was like we can do four subjects in a single day for revision. It was one of the best DVTs I had. Actually, what I used to do is I used to study a subject and I used to solve MCQs topic wise. Like
okay,
I used to do 3 days for PSM and I used
okay,
to solve 50-50 MCQs for PSM every day. And
wow,
after
okay,
that, on the fourth day, I used to get it gets monotonous. So I used to
yeah,
change the subject and I used
okay,
to grasp the small subjects like derma is there, anesthesia is there. They used to help me go through 50 or 100 MCQs in a single day. So
yeah,
we can cover a lot of ground in a single week.
yeah,
So it used to help me a lot. And GTs helped me a lot, man. And the most important thing was there were a lot of ups and downs, man. So
I'm
during
sure
the
they have been.
during the time I used to get a bit depressed that what's happening, what will happen after the exam. If we
Yeah,
don't crack the exam, what will happen? What is the next step we have to do? But
yes,
I used to watch Sumer sir's video. Motivational videos were one of the best. And
mm,
Sumer sir said one thing during our live class that don't be a watch gazer.
yes,
That helped me a lot. Never be a watch gazer. Just I used to um, sort out some topics I had to complete in a single day, and I used
mhm,
to complete those topics. After that only I'll stop studying.
that's wonderful.
Mhm.
So I am sure, Maulik, that there are tough phases that you would have seen, and it's not an easy task. But I think you have kept yourself going, and there are some wonderful tips that you are giving, which I believe are the reason why you have achieved such a good score. Because you talked about target-based study. I think that is your USP. It's very essential that you give yourself
Mhm.
well-defined targets. Let it be small targets, but
Yes.
try and achieve them. It gives you a feeling that yes, you're moving forward
Mhm.
and you're not static and you're improving yourself, right?
Yes, ma'am. It helps a lot. And if we break down small topics, we can achieve them, and it gives a dopamine surge, kind
That's
of
right.
dopamine surge. So it helps a lot. And
That's
for
great.
me, my backbone was my family.
I'm sure you cannot come this far without their support, right?
Yes, ma'am. My sister is a doctor, so she helped me a lot.
Are they
She used
happy now
to
with your
push.
performance?
They are really happy
Are
still.
they around?
It's
Can I
kind.
wish? Because once you reach this far, it shows the efforts they have also put in. It's not easy to send your child outside. It's not easy to let you go off. When you go, you are pretty young, and there are a lot of hardships that you face in a land which is not yours, right? So things are not easy, but you've done well, and I'm sure you're a strong boy, and you have a lot of capability which you were not even aware of. Am I true?
I think so, ma'am.
Yes. And
Bec-
yes, go ahead.
Actually, because of them, I used to, get motivated, and they used to push me that don't be scared. We are there for you, and if nothing happens, we are there as your backup. So don't worry at all, and you
That's
just
very
keep
sweet.
studying.
Yeah. So
And
great.
I dreamed about this interview a lot.
You did. So, see, if you dream, you make it happen as well. So, it's important to dream. It's important to have a bigger dream now as well, Maulik. I was
Yeah,
just speaking to you a little while ago, and you have to realize that this is not the end of something, it is the beginning of a new phase. Am I
yes,
right?
ma'am. Yes, ma'am. Yes, ma'am. This is the first step.
Yes, absolutely. And it just shows that you have all the potential, you have everything that you need to succeed in life. You're going to be a great doctor, you're going to be whatever you wish to be, a specialist, super specialist, whatever it is, right? So just dream big
Yes.
and then make it happen.
Thank you
And
very
Maulik,
much, ma'am.
before we say goodbye, I want to ask you, what advice would you want to give to your colleagues, juniors, people around who are preparing for FMG exams? What would you want to tell them?
I just want to tell them one thing that do everything in small amounts on everyday basis. If you make a big target that I'll complete surgery in 10 days, it won't happen.
Yeah.
Just keep on doing in small amounts and keep on giving GTs every 15 days or a month.
Yes.
GTs helps a lot, ma'am, because we can evaluate what are our pros and cons and what we need to do, what subjects we need to focus on. So it helps a lot.
Okay. So great piece of advice, Maulik. And any motivating things that you would want to say?
Um, Follow Sumer sir.
All right.
And just
Perfectly said.
keep on going. Don't
Yeah.
just keep on going. Don't stop anywhere. Because
That's
after giving the exam, you will see the results and you will be happy. You'll achieve what you want.
right. So, Maulik, thank you so much for making DAMS a part of your journey. It has been a pleasure to be associated with you, and we wish to contribute more to your achievements. Be a small part, but
Ah,
together we achieve success.
actually, you are a big part. I used to watch your videos a lot, and every dance faculty I want to tell thank you to all the dance faculty.
That's
Sumer
very kind
sir,
of you. Thank you.
ma'am, then Tiwari sir is there, Ankit sir is there, Sandeep sir is there, Sanjeev sir is there, Anupama ma'am. I want to thank all of them
Thank you,
because
Maulik.
without them, this wouldn't have happened.
Great. So we wish you a very bright future ahead, Maulik, and may you always keep smiling and always keep rising in life. Take care.
Thank you,
Loads of
ma'am.
love and good wishes coming your way. Thank you.
Thank you very
Bye
much,
bye.
ma'am. Bye.